Nicole from the Physio crew, and I'm doing my Ask Nicole. So today the question was how to help, I hope I'm getting this right, how to help lower back and hip pain. So I had loads on backs. Back's obviously a really common place to injure, so I'm going to try and keep the themes together so you get really educated in one area and then you learn about another one. So of course, how we help the pain depends on exactly what's going on. So for example, if you've got a capsular pattern, so you've got tightness in the hip in a certain sort of pattern of movement, so for example with osteoarthritis we know that you're gonna lose medial rotation. We can look at that and we can see whether we think it is to do with arthritis. A lot of people think that you need to have an x-ray for arthritis, but you don't, like, especially with something like the hip. We've got good clinical evidence that shows that most people will fit what we call a clinical pattern of stiffness. So they're stiff in a particular area more than other, and that kind of works with all of the 4 different movements, particularly with the hip. So with the hip itself, if you're getting hip and back pain, we have to think, okay, well, is it a referral? So is it a referral that the back is referring to the hip? So you can sometimes get pain that's going down the back of the leg. You've probably heard of that, sciatica. You can get pain down the front of the hip, which is because of the femoral nerve. That's where that nerve runs. You can get pain in the hip that's coming from the piriformis, which is in the bottom muscle, and that can refer, even though it feels exactly like it's the front. I mean, people always say that to me, like I'm prodding on whichever muscle is affected, and they'll be like, how am I feeling that? Like, it's in my shoulder and I'm feeling it in my neck, or I'm feeling it in my head, like what is that? And very, very common is referred pain, and we get that all over our bodies. The weirdest one that I've ever seen was TFL, which is a muscle down lateral hip on the outside of the hip, and it was referring to the opposite side in her cheek. And so they're quite amazing how the body works, and I guess you just learn those type of things with experience. You can learn a lot from a book. I'd never heard of that one from a book. That was definitely just experience, and then I spoke to another physio and he said, oh yeah, I read that somewhere as well, that can happen. So what we're looking to do when we're reducing pain and stiffness in the back and the hip is we need a clear diagnosis. So we're going to look at whether there's any osteoarthritis of the hip, whether the nerves are bringing on the symptoms. So if we do nerve testing, is that bringing it on? Because obviously we're going to treat the nerve very, very differently than a muscle. With a muscle, if you're tight in your straight leg raise, so that's lying on your back, legs straight, pushing up as far as you can go. If that's tight, if that's tight, then we're going to also look whether it's the nerve, because if it's the muscle, we can bully it, we can stretch it. If it's the nerve, we're not going to bully it because it's going to get angry at us, and then you're going to feel worse, then you're not going to want to come back and see me. So we're not going to do that. If it was a nerve type problem, we might look at doing sort of a nerve glide, and we can look at doing tensioners. We can look at causing tension at one end of the nerve, so it could be dorsiflexion, bending of the foot towards you, or it could be cervical spine flexion, or we can do a glide, so we can actually combine the two. So when we are bringing the chin down to the chest, we're tensing the spinal cord. So if that changes symptoms in the leg, as long as you haven't changed anything in the leg, it's unlikely to be the leg structure that is sensitized. It's more likely to be the neural system. I have a little look on YouTube if you want to know more about that, because I kind of feel like I'm diving into a huge amount of content, and you haven't really got a foundation for it, so it probably just sounds like a load of techno babble at the moment, which I try not to do, but I'm pretty bad at it. So yeah, the sort of things that you want to be looking at is where is the restriction, what is the diagnosis, and then how do we resolve that. So it might be that if, for example, you've got a restriction in your hip pattern, we might look at giving you some stretches to help increase that. So one of the things that a chap came in yesterday, he really wants to be able to put shoes back on, he can't put shoes on. And so I was looking at his hip pattern, I was looking at his majority is coming from the back, but we have to remember the gluteal tongue kind of at the back, that's a big bum muscle, that the gluteal tongue is the bit at the top that feeds into the spine. So what I did with him is did some soft tissue work on his QL, because that was tight, so we did some side flexions, I did sort of trigger point release, did some massage, did some joint mobilizations, and then after that what I did is I said, right, okay, let's look at how you're getting your shoe on. And what his brain was doing is as soon as he went into a flexion pattern, as soon as he came forward, his brain was just going, oh no, it's going to be painful, I'm going to tighten everything. And so I actually just spent 10 minutes with him, like, okay, lean forward and relax, and relax, and relax. And just help him to train his brain more than anything, because the subconscious brain is very, very powerful. It will tighten those muscles and it will restrict our movement if it's worried that we're going to do any harm or any damage to ourselves. So a lot of it is about training the brain that it's okay, you're not going to do any damage, but there's certain movements that you can do which are less likely to be painful than others, so we try and do that. So I hope that's been helpful in answering that question. I've got one more to do, but I'm not sure, I might be running a bit low well on time now because I've been talking too much, which is pretty standard behaviour from me, so I apologise about that. If you've got any questions, then make sure you ask. Please follow the Instagram, the YouTube, the Facebook, because I'm going to be releasing loads and loads of content, and just it'd be great to have some feedback. Like if there's something that you want to see more of, something you want to see less of, then just let me know and I'll try and deliver that for you. Alright, take care guys, bye bye.